So I'm Lawana Brown, and I am one of the faculty members with Regis College in the nursing program. I teach in the graduate program, so it's really a great kind of job. And I'm going to let you introduce yourself for those who will get the opportunity to view our conversation.
Sure. Well, I'm Allison Hernandez. I'm also a registered nurse by background and practice, I always say in my prior life, but I still very much feel like a nurse. And I also have my PhD in nursing. So I've spent time in graduate education with folks like you. And right now I am health legislative assistant in the U.S. House of Representatives on Capitol Hill, so in Washington, D.C., working on health policy. And that's kind of just sort of a top line summary.
Okay, that's amazing. So before we jump into the work that you're doing now, I always like to go back kind of to the beginning as to find out how did you end up being a nurse? Where did that come from? And what was your journey like becoming a nurse?
Sure. And I always say this one quick disclosure. Obviously, today I'm speaking on behalf of myself, right? And not any of the work that I do for my boss. But I feel like my journey to where I am today is very much shaped by my decision, 10 years ago to become a nurse, because it was truly a choice that opened a lot of doors. So I'm a second career nurse, or second degree nurse, as they say. I had an undergrad degree, or have an undergrad degree in psychology and languages. And so I didn't study nursing at an undergraduate level, but I was always interested in health sciences, and I knew I wanted to do something in health. And so I guess I didn't have sort of I didn't have the confidence at that point necessarily to pursue nursing. But right after graduation, I got a job as a research assistant, and at the medical school at the university I went to University of Miami, and I did a lot of clinical work because I worked in recruiting patients for these genomic studies. And I really love the patient researcher interaction. But what I found even more interesting was that my project managers were all nurses. And they were nurses that were getting their master's in business administration. They were getting their PhDs. And I didn't know at that time, I was, 21, that nurses really took roles that were beyond the hospital, right? And so I thought, this might be a really good career for me, very versatile. I had a lot of mentors that sort of pushed me in the nursing direction. And so I decided to apply to a master's entry practice program. And I moved to Chicago to do that at DePaul University. And it was an accelerated program, so super quick, a little under 2 years. Did that, and I practiced. I was lucky to get hired into a hospital that had a new grad program. So, a lot of the intense sort of not holding of hands, but you're familiar, right? Where you get precepted, and it was really formative in terms of being my first job. And I worked as a medical surgical trauma nurse in Irvine Hospital in Chicago, level 1 trauma. And it was really exciting. I really loved it. I really love my colleagues too. The camaraderie, I think, of having a great team helped solidify the fact that I had chosen this career. And so it was during my time as practicing as a nurse that I started to really cement this idea that health happens outside of the hospital, and what we're providing in the hospital is sick care, which is logical, right? But I think the more I practiced and the more complex patient care became, someone would come in, for a hip replacement, and then they were also dealing with 5 other comorbidities. It made me really realize that, the social determinants of health are huge, and how do we work on those? And so that's when the first policy light bulb turned on. And then from there, through mentorship, through people like you from graduate school, from my nursing program, I was sort of pointed in the direction of a research degree, so the PhD, really encouraging the idea that not a lot of nurses are in research and that we need more nurses in research. So I applied, and I was lucky to do like a little pre-doc program that was funded through some grant money. And so I got to like get a taste of what it would be like. And I got accepted into a program at the University of Illinois at Chicago. And so I did my PhD there. Caveat being that I was also lucky, but also under a lot of a time crunch, because I got selected as a Future of Nursing Scholars Fellow through the Robert Wood Johnson Foundation, which their mission was to accelerate nurses through their graduate research education. So I had to do my PhD in 3 years, which, yeah.
Okay, we need a moment of silence for that, because that was an accomplishment for sure.
Yeah, no, that was, and I people always ask me if it's advisable, like people going through PhD programs, and I was like, I think it's for some people for sure.
Right.
Do I advise people to choose that path? Not necessarily, because I felt like it started and it ended. But it was during that time that doing, my dissertation work, I've always been interested in older adult health and well-being, and I focused on physical activity promotion with older adults who were chronically ill, specifically with lung disease. And it was during that time that I got more interested in policy, because the research project I was doing, I did it at the VA, one of the VAs in Illinois, and we'd had patients come in and participate, and they would love it. They do our exercise program, but then outside of the lab that we had for them to exercise in, they didn't have a place to go. Right. And I was like, but you served our country. You're here in the VA. How is it that you don't have access to somewhere where you can come? So that's what got me thinking about policy more. And I had a really inspirational, I guess, professor who took her research unrelated to mine. It was breast cancer, health disparities research, and changed state legislation, literally. And she did a seminar, and I was like, why aren't more nurses or researchers or clinicians translating their work into actual policy change? And so that was sort of the nail in the coffin.
Wow. Yeah.
Yeah. Sorry, go ahead.
And I was going to say, I can see how that really would have inspired you. Was there a particular patient? I know you said you have a passion for those that are older, the older patient population. Was there a particular patient or a family member or a story that kind of informed that passion?
Great question. My grandmother, I have a very good relationship with my grandmother. I feel I've always been really connected to her, even since I was little. And we grew up in different countries. I grew up in Mexico, and she was here in the US. But I still spent a lot of time with her, and to this date I do as well. So I think that, that contact informed my love and passion for all things older adults. And as I went through my career as a nurse, so when I was a research assistant, the project that I was working on was Alzheimer's related.
Oh, wow.
And so I dealt with a lot of older adults and their families. And I think that really also cemented the clinical love for treating and helping older adults, and not as opposed to not, I obviously any patient, it was great, but I really always had a soft spot for anyone who was just older. So that was the root of that.
Wow. Well, and it's funny because with the older population, they face a complex, group of issues. And then, like you mentioned, a lot of the policies that surround their access to care, if you haven't taken care of someone that's older, you don't really know how difficult it is. I had in-laws that both were diabetics, both on dialysis. And when they got to the point where they needed other types of care, it was a minefield trying to figure out what they qualified for. One had been a vet, and kind of walking through the nuances, and it was pretty complicated. So I can see how, the policies and everything surrounding that make a big difference, with the level of care that patients have.
Well, we also have a changing aging demographic, right? So our demographic age pyramid is flipped. Now we have, speaking of policy, fewer people working, or there's one worker supporting many more retirees, and that's only going to get worse because literally there are more people turning 65 than babies being born. I think there's something like every day 10,000 Americans turn 65. So wow. I see a lot of opportunity in that. I'm of the mindset that there is a lot of social capital, a lot of things to reframe aging. We're all aging, so it's not an exclusive older person's thing. But also just from a policy perspective, to think how we build a country that uplifts older adults, but also maximizes the money that we need to, like you said, with your in-laws, to support aging. Age-friendly cities and age-friendly programs and housing and, all of those things.
Exactly. That definitely makes a difference. So, with policy, I go back to thinking, I chance to listen to a conversation that you had on Amplify Nursing with Congresswoman Shalala at the time, which was very insightful. And one of the comments you made there was that being a nurse makes you a health policy expert. Could you speak a little bit to that? And the reason I say that is because, and I'm not speaking for every nurse, just for myself, but you get into nursing, you're doing the work that you're doing, and that just, the policies in your institution, as long as it's okay in the hospital where I'm working, we kind of, put ourselves in that little silo and we don't think about the bigger picture. But can you speak a little bit to why, as nurses, we need to look at those roles and how we are indeed policy experts?
Sure. And to answer your question, I'm going to backtrack just one step so that, because I think this is important and it relates to your previous question on older adults. So, when I finished my PhD and I decided that policy was going to be the thing, I pursued a postdoctoral fellowship that would give me that experience. And that's when I found this health and aging policy fellowship, which is what brought me to Capitol Hill and to the office of Congresswoman Shalala. And happy to talk about the program, but that was legitimately a group, a fellowship of folks that love and breathe and do all of their work in service of older adults, and to be the voice of older adults on Capitol Hill or in government. And so when I came to Washington, D.C., and I was lucky enough to become a fellow in the office of the Congresswoman, that's when that idea of being a nurse makes you a health policy expert really gelled. Because, well, first and foremost, and this is not a trade secret, but people on the Hill who are making and creating health policy or changing health policy are not healthcare providers, right? They're not people who have healthcare experience or healthcare delivery experience.
Exactly.
Because there's the business of healthcare and then there's the business of delivering the healthcare. And so, in being a fellow and starting to really understand the legislative process and who influences policy, it just kept coming back to me that I with the stories in terms of the experiences I had at the bedside and understanding patient care, knew much more about health care and what matters than a lot of people that were trying to, influence the process and introduce bills. So that's when I thought I need to make sure that when I speak to nurses about policy, I start from a premise that we are all experts based on our lived experience alone. And then some of us, like me, get to learn more and want to learn more, but at least at baseline, we all have the capacity because of the work we do. So that's where that was born.
Yeah. And I do think you're right about that, because I know a lot of the work that's done policy wise, the nurses don't necessarily always have a seat at those tables. And I think Congresswoman Shalala made a great point that I had not thought about in 15 years plus of nursing, which was that there are more nurses than there are doctors. But yet a lot of the decisions being made are clearly driven towards, doctors and physicians and, the needs specific to and not towards nursing. So that got me to thinking as well. So with us in nursing as nurse educators, with the programs that we have, because we just have, baccalaureate nursing program and graduate nursing programs, how do we begin that conversation even with the students that we have now? Do you feel like you got exposed to the idea of being a policymaker in school yourself? I know I didn't.
Yeah, no, I didn't. And that's my soapbox when I also talk to nurses and students, is that, to be honest, look, I went to a master's entry program, then I went to graduate school. And it wasn't until my postdoctoral fellowship that wasn't in a school of nursing. It actually started at Northwestern in Chicago. And it was an interdisciplinary program with a lot of physicians, physical therapists, there were other nurses. But it wasn't until then that I really had like an obvious health policy class or a health economics class. I didn't receive, it wasn't part of the curriculum at any point, health policy in general through my master's or my PhD. There were leadership classes that perhaps dabbled in the idea, but I never had actual training in that. So, and I think that is part of the issue, is that my experience isn't necessarily the next nurse's experience. I've heard many nurses say, oh yeah, I took a health policy course when I was doing this program. But I do think it needs to be like standard. I get it. NCLEX doesn't ask you health policy questions, but maybe it should.
Yes.
Right? So it should be taught at a bachelor's level for sure. I mean, I think at any level, but, it should be, the seed should be planted. And the reason why we have also, more physicians lobbying and making or influencing policy is because at the end of the day, physicians deal with a lot of reimbursement.
Right.
And so that makes them really interested in wanting to have a say. And so I think nurses are, for the most part, so busy. We're so ubiquitous and we're so busy taking care of patients. I mean, physicians do too, but also they have that administrative role that we forget that they're, there's other things that matter, that influence the work that we are doing, and that we should be participatory. And I'll just sort of end my little soapbox with this. I remember sitting in the only health economics class I've taken during my postgraduate program and thinking, all the physicians were like, they really understood it really well. And I was like, why? I felt like a deer in headlights. I was like, oh, this is how healthcare, the business of healthcare works. And this is the role of healthcare in our economy. And I'm at the front line delivering care, yet I don't understand this. So anyway.
Yeah, and it's interesting, because I don't think that I began thinking about it even until I became a nurse practitioner. Right. And then you start thinking about, okay, reimbursement and scope of practice and things like that. And I'm like, well, what can we do? And who decides what we can do? And why can they do this in New York and we can't do that here? Those kind of things. And it became an interest because we realized that there were tables we needed to be sitting at to say, this is something that we need to discuss because it's not working, for us or for the patients. So I do think, and I didn't have a health policy class. I mean, you hear it talked about vaguely. We talked about ethics, but that's a whole nother thing. But the policy portion we didn't. So I think it's amazing that we have folks like you that are doing this type of work. So in this stage where we are now, and I don't think that we're ever going to be in a post-COVID stage. I think we're just going to be in the new place that we are now, where we and COVID coexist, and we try to, keep the better side of things for us. Are there particular issues now, or what would you say are a couple of the paramount issues that you're looking at now regarding nursing health and healthcare in general that we as healthcare providers need to be, these are conversations, even if we're not having them, that we need to be attuned to who the players are and what's going on with that?
Right. So I think, just at baseline, aside from like specific issues and specific legislation, I think it's really important for all of us as a profession and as a body to try to stay informed. I know the news cycle is really intense. And oftentimes I encourage everyone to question everything you read, no matter where it comes from. But I think at baseline, the number one thing is, I think, and this is just civics 101, right? It's great practice to pick a couple sources you trust and stay on top of what's going on in terms of politics, and then really leaning on advocacy groups. So organizations, whether you're a nurse practitioner in a certain area or you just care about this one, it doesn't even have to be specifically healthcare. It could be related to gun violence, whatever issue you care about. If there's a group or a local organization that's doing work around it, to get involved. I think having a nurse's voice in any of those planes is really important. And then being actively engaged, because groups like that teach you a lot about what policies they're advocating for and how they go about it. So that's just kind of, for me, like step one. In terms of the work that I do now in health policy, so it's very much determined by the committee that my boss serves on. So my boss is on the Committee of Ways and Means. Ways and Means has jurisdiction over all of Medicare Part A. We share jurisdiction over Medicare Part B with Energy and Commerce, which is the other healthcare committee of jurisdiction on the House side. And then we have tax. So all revenue raising measures come from the Committee of Ways and Means. So we do a lot of really big policy.
Yes.
So a lot of the work that I do for my boss hinges and focuses on the jurisdiction of the committee. So we work on a lot of, for example, workforce issues related to nursing home, direct care. So like a lot of the stuff that I'm doing for my boss is looking at ways we can, pay folks better who are delivering care in long-term care, and how do we attract and retain diverse group of people to want to do this work and be paid well to do this work. So things like that, but more specific to nursing, there's a lot of there are 3 nurses in Congress. So that's really exciting. We have Bernice Johnson from Texas, Cori Bush, Missouri, and then we have Lauren Underwood from Illinois. And particularly Lauren Underwood has been an incredible healthcare legislator because she's worked a lot on bills related to like maternal health and mortality, a lot of the Affordable Care Act fortification, making sure people can afford and access care, lowering the cost of insulin. So those are a lot of the bills that someone like me working for my boss are looking at and making sure that we're co-sponsoring and we're supporting because they're aligned with our agenda. And then I know that Lauren Underwood has a specific bill, which I think this is the stuff that gets me jazzed up about for nurses, education specifically, is there's a bill she has that basically tells HRSA to appropriate money to release grants. So states would get these grants, and then states would figure out how to get these grants to school. I guess schools would apply to, but they would go out to bolster nursing school education. So they would help faculty income, for example, to help make sure that people want to stay teaching, because we know there's a huge faculty shortage.
Oh, yes, you're right. Yes.
Yep. And then also just, a lot of money related to just this post-pandemic life and how do we help fortify the workforce pipeline. So that's all workforce related. I get a lot of questions about nurse practitioner related legislation. And so there's some as it relates to like Medicare and sort of referrals and who can refer what, and we should allow nurse practitioners to not have to go through 5 loopholes, if they're dealing with Medicare. So there's bills like that, but I always like to say that if you're dealing with a particular nurse practitioner legislation or issue like scope of practice, that's all at a state
yes, it is.
legislative
You're right.
well, right.
It is. Yeah. I'm in South Carolina, and unfortunately we have struggled to, change the policies as far as what we're able to do, moving towards more autonomous practice. We did have a major kind of breakthrough last year when we were able to remove the mileage limit that was there that, kind of tied us to our physician preceptors, which, that was but it took years,
right.
to get to that point. So I'm glad to know that there's so many things going on policy wise. And it kind of makes me also want to encourage nurses and nursing students to be involved in your representative organizations, your nursing organizations that are there to kind of, because I know they keep their ear to the ground as to what's going on, depending on your specialty area. So that's something as well. So as we kind of round out, I always like to ask everyone that I speak to, there's so much that we hear, like you said in the news. I limit my consumption because it can be kind of depressing when you think about all the things we're working on. But when you look at the policies and things that you're working on from where you are, what is it that gives you the most hope? What makes you feel hopeful? The things that you see day to day that make you feel like we're moving in a good direction?
Oh, I love that question. And I'm glad to end on a high note. I think first of all, I think philosophically, even though the media tends to amplify the lack of bipartisanship, for example, in the work we're doing. So this is just more general. And a lot of it is true. Like, I wouldn't sit here and just say that, oh no, it's all a charade. But the truth is that there's still a lot of, the federal government is full of really amazing, knowledgeable, hardworking public servants. I still look at the Capitol, and it looking at the Capitol itself, and this picture behind me is the Capitol dome inside. It still gives me butterflies and hope. And they say that as long as you feel that way, you're still okay to stay, working, doing what you're doing. So that's just that baseline. There's just a lot of amazing, very, just passionate, intelligent people working in service of our country and making sure that we get the right things done. I think particularly on a policy, policy specific level, I get really excited to see progress when it comes to, talking about how we improve. Well, and this is nursing specific. So one, how do we improve the workforce, the pipeline? How do we make sure we're attracting diverse nurses to the workforce to reflect our diverse country? We know it's really important to have practitioners that look like you and have your background. So that's really exciting. That's why I mentioned like Lauren Underwood's bill, but also the importance of workforce as it relates to our aging population, right? I feel really, really passionate about the work that our committee does around making sure that as we age, people have quality care, whether that be at home through, direct home care or in a long-term care setting. And we're all going to need all of that because we're all hopefully going to live longer and better lives.
That's the plan.
Right. And so the oversight, the making sure that there's quality in the price that the federal government pays, I think that to me gives me a lot of hope. And, just to insert this last stick, we're working on this Build Back Better bill. If you follow the news, you've read and heard about it. And there's so many amazing policies that are in that are transformative for maternal health, for insurance, for fortifying the Affordable Health Care Act, for lowering the cost of drugs, for protecting seniors. So I think there's a lot of really good stuff. It's just sometimes we get bogged down by all the other stuff.
Exactly right.
So that gives me hope.
That's amazing. Just hearing you talk about it makes me hopeful because it lets us know that there are some solutions there and there's some change that is coming and that the people that are there really, really have the best interest of the groups that we're talking about at heart. And that makes a big, big difference. So I appreciate the work that you're doing. It energizes me when I hear people talk about policy. And what I'm glad about is that even though we don't have as many folks in policy, from the nursing side, although we want to encourage that. So students that are listening, we want you to do that. But the ones that we have such a passion for, being able to make the changes that are needed. So we really appreciate you talking with us and the work that you're doing. And we're grateful for your grandmother because of the inspiration that she gave you to continue to inform your work. And so hopefully we'll be able to see some changes come about. It may be slowly, but as long as we're moving in that right direction, that makes me hopeful as well. So I thank you so much for joining us.
That's what policy change is. It's incremental.
That's right. Small steps.
Good reminder. Small steps. Yeah, big changes.
We'll get there.
Small steps.
We will get there. Well, thank you so much. We appreciate talking with you, and hopefully the next time we talk, we'll be on to some other subjects because we'll have already, cemented some change that can really make a big difference for all of us. Okay?
Absolutely. Thank you.
All right. Take care now. Bye-bye.